reasons like we were just discussing. So let's start. Okay, so objectives. So at first we'll do a basic overview of sleep and its stages. We'll discuss the benefits and the purpose of sleep. Then we'll go over various causes of sleep deprivation. And by any means, the list is not all inclusive, but tried to include as much as what was coming up off the top of my head. Determine the effects of sleep deprivation on the human body, and then some tips for practicing sleep hygiene, and the efficacy of pharmacotherapy. As Dr. Smith was just saying, everybody wants sleep medications because of insomnia, but a lot of times it's the underlying cause or the root of the insomnia that needs to be treated for them to actually get, an improvement in their sleep pattern. Okay, so first going to start off with a basic definition. What is sleep? So sleep is a naturally recurring state of mind and body characterized by altered consciousness, relatively inhibited sensory activity, inhibition of nearly all voluntary muscles, and reduced interactions with surroundings. It is distinguished from wakefulness by a decreased ability to react to stimuli, but it's more reactive than being in a coma or disorders of consciousness. Sleep displaying very different and active brain patterns. Okay, so the stages of sleep, and again, this is very basic, just so to make it all, for sake of completion and thoroughness. So usually sleepers pass through 4 stages of sleep. Stages 1, 2, and 3 are considered the non-REM, and we're going to discuss what REM is. It stands for rapid eye movement. And then the 4th stage is the REM stage itself. And these stages progress cyclically from 1 through REM and then begin again. So it's kind of like a continuous cycle. A complete sleep cycle takes, on average, about 90 to 110 minutes, with each stage lasting between 5 to 15 minutes. The first sleep cycles each night have a relatively shorter REM sleep phase and long periods of deep sleep, but that changes later in the night where REM periods lengthen and the deep sleep time decreases. So stage 1, it is the lightest stage of non-REM sleep. It's defined by the presence of slow eye movements, and this is where you'll feel drowsiness. So it's a drowsy sleep stage, and it can easily be disrupted, causing awakenings or arousals. The muscle tone throughout the body relaxes, and the brain wave activity begins to slow from that of wakefulness. And this is a little chart, but again, we're going to discuss each stage separately. So stage 2, it's the first actual stage of defined non-REM sleep. Awakenings or arousals do not occur as easily as in stage 1 sleep, and the slow-moving eye rolls discontinue. Brain waves continue to slow with specific bursts of rapid activity, and these are known as sleep spindles, intermixed with sleep structures known as K-complexes. Both the sleep spindles and the K-complexes are thought to serve as protection for the brain from awakening from sleep. Body temperature begins to decrease and the heart rate begins to slow down. I remember even in med school, kind of like the mnemonic, if any question had said sleep spindles and K-complexes, you know that they're talking about stage 2 of non-REM sleep. Stage 3, this is known as deep non-REM sleep. It's the most restorative stage of sleep, consisting of delta waves, aka slow waves. Awakenings or arousals are rare, and often it is difficult to awaken someone in stage 3 sleep. This is also the stage of sleep where we tend to see parasomnia, such as sleepwalking or sleep talking, aka somniloquy. And night terrors occur during the deepest stage of sleep. So right before going to REM stage, this is, what we as sleepers are going through. So finally, REM sleep, known as rapid eye movement, this is what we call the dreaming stage. Eye movements are rapid, moving from side to side, and brain waves are more active than in stages 2 and 3 of the non-REM sleep. Awakenings and arousals can occur more easily in REM, and being awaken during a REM period can leave one feeling groggy or overly sleepy. And this just graphically shows different stages of sleep cycle, and depending on how much sleep we are getting through the night, the different changes that occur to body in terms of temperature, brain waves, everything. These were the wave patterns that I was talking about. As we can see, awakeness, you'll see quite a bit of brain activity, and the patterns quite different from what we see in stage 1, 2, 3. And REM, we kind of see exactly how different they are. The stage 2, that spindle in the middle, that's the K complexes and sleep spindles that they were talking about. So the benefits of sleep, and there are many. So number 1, stress reduction. Anyone who's getting deep and regular sleep, their levels of stress hormones will be better regulated or better controlled. The stress hormone, we all know, it's cortisol, and of course, if we have plenty of cortisol, that will lead to weight gain and other unhealthy habits or problems down the line. So improving memory. So obviously, sleep helps the brain to organize information, stores memory. It improves processing, so we turn up sharper, more attentive, and focused throughout the day. It helps in lowering blood pressure. So by encouraging a constant state of relaxation, the blood pressure is better controlled, so less likely to risk heart attack or stroke. It helps boost the immune system. Statistics have shown that it helps lower the risk of developing a cold by 3-fold, along with reducing signs of aging by promoting healthy skin, and also prevents episodic migraines and headaches. Next, helps weight maintenance. And this is also by hormonal regulation that affect the appetite. We might also find less cravings for high-calorie foods if we are getting regular sleep. It improves mood, decreases agitation, improving our ability to stay calm, controlled, and reasonable. So judgment is definitely affected in a positive way if we are getting enough sleep. May reduce the risk of developing diabetes type 2 because of lack of sleep. It's altering the way the body is going to utilize glucose or process glucose. So if we're not getting enough sleep, those mechanisms are not quite in check, so higher risk of developing diabetes. In cardiovascular health, a regular sleep pattern can help lower the levels of stress and inflammation to the cardiovascular system, which will then, in turn, reduce chances of developing a stroke or a heart condition. Pain control studies have shown a link between sleep loss and lower pain threshold. So the more sleep you get, the less pain you might be in. Now, a lot of studies are still pending on this, but yeah, there is a correlation. If we're sleeping better, pain is well controlled. I don't know if we're sleeping through the pain, but still, there's a positive correlation. And lastly, it improves libido, and this is by boosting testosterone levels. And this chart goes through, and it's just vague, but overall sleep recommendation depending on what stage of life we are in. So as we see, the newborns, the recommendation is more than 2/3 of the day, but 16 to 18 hours per day is the amount recommended. Preschool aged, go down to about 11 to 12, then 10 hours a day for school-aged children, 9 to 10 hours a day in teenage, and then adults plus the elderly, 7 to 8. Most of us are not going to be getting our 7 to 8 hours a day, and that's what we're going to talk about next. Are we getting enough sleep? So the American Academy of Sleep Medicine and the Sleep Research Society recommends that adults aged 18 to 60 years sleep at least 7 hours each night to promote optimal health and well-being. Sleeping less than the recommended 7 hours is associated with an increased risk of developing chronic conditions such as obesity, diabetes, high blood pressure, heart disease, stroke, and frequent mental distress. Approximately 40% of Americans are getting less than the recommended amount of sleep each night. That's quite a lot. Now, causes of sleep deprivation. And again, these are not all inclusive, but I tried to include a little of everything. So obviously, anxiety or stress. Now, this can be chronic versus acute. If somebody's got chronic anxiety, they're prone to having racing thoughts, or just, they feel as their brain is not able to shut off, they're going to have a hard time falling asleep or remaining asleep. More so acute stress, let's say there's a exam coming up the next day, or it's coming up and you're not quite ready, or if you've been busy cramming for exams, it's going to throw off your sleep cycle. It's, hormones are going to be, the adrenaline rush is going to make you have a more difficult time in actually falling asleep. Depression, one of the criteria when we do our SIGI CAP screening, sleep issues. So obviously difficulties falling asleep or sleeping too much in atypical depression, or if somebody's bipolar and they're undergoing the manic phase where there's a decreased need for sleep. So that would be under mental health disorders. Medications, for example, stimulants, if somebody's being treated for ADHD, or let's say narcolepsy, where you are sleeping at, the most awkwardest times, or, random bouts of sleepiness. So any stimulants, let's say somebody takes them a little too late in the evening, that, the medication may very well make it hard for you to fall asleep at a normal time. Nicotine use, and this includes cigarette smoking, vaping, because even the electronic liquid does contain nicotine. So again, these would be considered stimulants. Even chewing tobacco, any nicotine or stimulant effect would make it harder for you to go to sleep. Alcohol. Now, obviously, alcohol is a central nervous system depressant, but at the same time, just like, one drink, it'll take, let's say, somebody 30 minutes to 60 minutes for it to wear off. In that same way, while the effect of alcohol may help induce sleep, once that's cleared and, out of your system, you might whoever is drinking may have a hard time falling back asleep. So, good luck trying to remain asleep with alcohol. Circadian rhythm being off balance, and this can be for those who work second and third shift, or are jet lagged from, traveling across different time zones. Now, circadian rhythm, that's basically the system in our brain that helps distinguish night from day. And we'll talk about that a little bit later on too. Snoring, and I know we were just talking about that not too long ago, right before this began. So if somebody's got obstructive sleep apnea, that can definitely deprive them of sleep. A, you're not getting enough oxygen through your bloodstream. Secondly, if you're gasping for air, hence the apnea, the quality of sleep is going to be disturbed for sure. So you're not getting, a constant 7 hours. You'll have multiple frequent awakenings throughout the night, and one of the criteria is daytime sleepiness. We have reactive airway disease such as COPD or asthma. If something as simple as allergies are bugging you, or if somebody's a chronic smoker and they have developed that smoker's cough, they're not going to be able to have a good quality of sleep throughout the night. GERD or acid reflux or indigestion. If acid reflux is not well controlled, people can wake up thinking they're about to have a heart attack, because it can, when the acid travels up towards the chest area, it can kind of mimic chest pain. Chronic pain, if somebody's being awakened by pain, they're not going to be sleeping as comfortably as they should. One thing I did forget to write in terms of medical conditions, prostate issues. If somebody's got a BPH or an enlarged prostate, they're going to have to wake up multiple times throughout the night to urinate, and that itself is going to disrupt their sleep. And then lastly, poor sleep hygiene, such as blue light exposure from the screens, and this we'll talk about also. And then screen time, because any form of screens, whether it's TVs, laptops, cell phones, tablets, it's the exposure to the blue light that kind of keeps the brain in a constantly stimulated phase. So effects of sleep deprivation, which it might actually sound a little redundant, but it's goes completely against, or it's going to be the opposite of the benefits. So mood is affected greatly, resulting in increased issues with depression and anxiety, making one more angry or irritable. Focus and concentration are affected, which results in poor judgment and reaction time, resulting in being less productive and more prone to making errors. approximately 20% of all serious car crashes are due to drivers being drowsy behind the wheel. And I know I quickly saw the news before I came into work this morning, and they were mentioning something along the lines of how many of us are sleep deprived, and a lot of car accidents, I think they were saying between 15 to 20% are because of not getting enough sleep the night before, especially. Sleep helps repair damage to our cells and tissues and helps in building muscles. So a lack of sleep is linked with muscle atrophy, which is just wearing down of the muscles. Effects of sleep deprivation. So there is a 7.5 times greater risk of obesity, greater predisposition to diabetes, and a 45% increase in the risk of heart attack for those who are chronically sleep deprived. There's an increased risk of colon and ovarian cancer, especially in those with disruptions in their sleep cycles due to shift work. And this was news to me. And obviously studies are still pending, but they have shown a link. Prolonged sleep loss also causes vision changes, blurriness, and may even result in hallucinations. Ask anybody who's stayed up all night studying for a test, or multiple consecutive nights are just not getting the amount of recommended sleep. Yeah, they might feel like they're becoming delirious, seeing things, hearing things. So yeah, it affects speech, often resulting in slurring, repetitive word usage, or monotonous tone. And then finally, chronic pain sufferers with lack of sleep have shown to have a greater sensitivity to pain. And this, just for completion's sake, many of the common medications that we do use to treat insomnia for our patients. In the benzos, there's Restoril. There's the orexin receptor antagonist Belsomra, which is one of the more recent ones. Seroquel, which is an antipsychotic. We have over-the-counter melatonin, as well as Rosarum, which are melatonin receptor agonists. And melatonin, just for physiology's sake, it is released by our pituitary gland, I believe, which then helps helps the brain distinguish night from day, and that's what sets our circadian rhythm. So a release of melatonin is what will let us know that it's time to kind of shut the brain down and that it's sleep time. We have antihistamines that Dr. Smith was just talking about, hydroxyzine, aka Vistaril, and then there's diphenhydramine, which is Benadryl. We have some herbals, and then the non-benzo receptor agonists such as Sonata, Ambien, and Lunesta, and then antidepressants such as amitriptyline, mirtazapine, or Remeron, trazodone, and doxepin. Now, again, for completion's sake, these just show some of the adverse effects of these medications. Dose adjustments depending on what other medications they're on. Is there any history of any liver disease? Some of them, for example, amitriptyline, since it's an anticholinergic, you might see increased QT intervals, so we would need a EKG prior to even prescribing that medication. Some you'll have orthostatic hypotension, basically just overly sedating side effects that may not really be in the patient's best interest depending on what else they're on. So recommendations, these three societies, they're sleep societies, but they all recommend using cognitive behavioral therapy first. Ahead of anything else, CBT is what they recommend. The American Academy of Sleep Medicine has recommended Ambien, Lunesta, Sonata, Belsomra, doxepin, and Rosarum, whereas the European Sleep Research Society, for short term, so if you're going to be putting somebody on something for less than 4 weeks, Ambien, Lunesta, Sonata, and antidepressants are recommendations from them. And in terms of long term, they don't recommend any medications. The American College of Physicians, for short term, this time they said unless not more than 5 weeks. Ambien, Lunesta, Belsomra, doxepin, Rosarum. And again, long term, they do not recommend any medications. And there's no recommendations for one medication over another. What works for one patient may not necessarily work for the next. So, it'd be a patient-to-patient situation. Again, I've used this slide a number of times before, so just to general overview of cognitive behavioral therapy, which should be the primary method used to help in the treatment of insomnia. And avoiding use. So those three societies that we just talked about, the AASM recommends avoidance of diphenhydramine, melatonin, trazodone, tiagabine, L-tryptophan, and valerian root, which is one of the herbals. The ESRS says to avoid use of antihistamines, antipsychotics, melatonin, valerian, and herbals. And the ACP recommends avoiding benzos, melatonin, diphenhydramine, and trazodone. And Belsomra in general, it has increased risk of side effects, and depending on what other conditions the patients have, that interaction may actually make things worse, and so it would not be in their best interest. So some sleep hygiene practices, avoiding or limiting caffeine-containing products such as nicotine or alcohol. Avoid drinking excess liquids after supper, and this is something we tell those with enlarged prostates as well, because if you're going to be waking up multiple times in the middle of the night, you're going to affect your sleep quality and quantity as well. Avoid or limit daytime naps to not more than 30 minutes in the early afternoon. Make sure it's before 3 p.m. so that way your body doesn't think it's somewhat well rested, and that's just going to make it harder for you to fall asleep at your normal time. Create a dark, quiet, temperature-controlled bedroom. Avoid heavy meals within 2 hours of bedtime. You can have a light snack if you're hungry, and this will help prevent acid reflux. Maintain a regular daily schedule of activities, including bedtime and awakening times. Exercise regularly during the daytime. Avoid active exercise in the late evening. All those endorphins that get released might actually help promote energy and kind of make it harder for you to wind down at the end of the night when it is time to go to sleep, especially if you've just worked out not too long ago. Use your bed only for sleeping or sexual activity. If you're reading, or some people like to eat in bed, all that, the brain's going to start to kind of link those activities together, so it's going to have a hard time distinguishing, okay, am I supposed to fall asleep? Am I supposed to feel hungry? So yeah, using your bed only for sleeping or sexual activity, which kind of goes into the next statement. Do not eat, work, or watch television while in bed. If you cannot sleep, get out of bed and go to another room if you have not fallen asleep within 15 to 20 minutes. It could just be that no matter what you do, either you're gonna lay there and waste time because you're unable to sleep, or your mind's got something else going on. So at that point, feel free to get up and do something. Just go to a different room. Setting time to relax before bed with 20 to 30 minutes of relaxation, and this can include soft music, medication, breathing exercises, taking a warm bath, anything to kind of just help you relax. Even warm milk tends to work quite well. Now, I'm going to open up for questions. Now, one thing I did mention about blue light filters, I actually definitely recommend this to my patients as well. I actually blame med school, and that's the biggest reason I've had issues with sleep ever since med school, whether it's taking the board exam or being anxious regarding the board exams. And then once you're done, not knowing how you did, then waiting 3 weeks to open up an email letting you know if you've passed or not passed. So all that definitely has kind of messed with my sleep cycle quite a bit. And then let's fast forward to residency, where we have normal or somewhat normal schedules, and then we're on night float for a month and are expected to switch right back once that month is done. And that actually, I remember it took me about 2 weeks for my sleep cycle to somewhat normalize, and then kind of go back into that normal day-to-day routine until 2 months later when it was my turn to do night shift again. So, I have no problem in saying that I still struggle with sleep issues. I try not to rely on medication, but the blue light filter is something that has helped. If I can't sleep, first of all, the phone brightness, put it on low, because less strain on the eyes, less you're trying to focus and make your brain work even more than it should at nighttime. What I would do is I would put the blue light filter on, and this will kind of make the colors a bit more orange. more yellowish orange, and it gets a bit more noticeable as the day goes on and approaches midnight. So, and within 10 to 15 minutes, I will find myself almost about to fall asleep. And I do end up falling asleep deeply because with the blue light filter, you are assisting the brain in releasing melatonin, which will then help you fall asleep. The dangerous part is sometimes I'll be on eBay and I'm almost buying things in the midst of almost falling asleep, and I have stopped myself a few times. So with that said, any questions?